This is Christine Porter with the Times News. I'm talking today with Dr. Courtney Chellew about mental health and suicide prevention. She is a psychiatrist with Lehigh Valley Health Network.
Can stress of COVID, loss of job, financial concerns, etc., cause a person who's never been suicidal before to start having those thoughts?
We certainly know sometimes really severe depressive episodes can be triggered by life stress. And there is a lot of life stress that has changed because of COVID, be it employment or losses of people that someone loved. There's a lot of different changes that have happened in a very short period of time that were relatively not thought would occur. We do think of suicidal thoughts as a symptom of a mental health problem, be it bipolar disorder or depression, something along those lines, and that these are things that we can get treatment for.
What are some signs that someone you know might be considering suicide?
So, I would really think of more like the serious symptoms of depression as being a sign that maybe that was something that was going on. So extreme isolation, people struggling to really be motivated to do much, take care of themselves, get out of bed, missing work, school, important obligations that they wouldn't traditionally miss. Sleep changes, too much, too little, appetite changes, not able to focus, withdrawing. We do know also like people, mentioning suicide more, talking about that more. Sometimes people do vocalize, I wish I wasn't around anymore type of statements to family or friends. So those are pretty concerning statements to me. I wish I wouldn't wake up, or I wish I would get sick. That something serious might be going on.
If someone you know mentions these things, don't just disregard it as silliness, but take it serious.
I think it's very important to take it seriously, and that if anyone is saying those types of things, it should be taken very seriously. And if those types of things were going on, to really have actionable steps that were being put in place. And we know from the evidence to limiting means. So if someone had a lot of firearms in their home, that just moving them to a trusted family, friend, or neighbor could be a really helpful tool in lowering their risk of suicide. Sometimes when people get really depressed and they're having suicidal thoughts, your brain almost tricks you into thinking that things will never be different, that this is the way you will feel forever. And that's really not the case. So putting more barriers in place to prevent something impulsive from happening can really be protective. So, limiting the number of medications, not having the giant medicine cabinet full of large bottles of prescription medications, only doing pill organizers or locking those types of things up. That can be also effective strategies, having somebody in the family manage the medications. You bring over my pills every Sunday in a pill box. And so then you don't have the large bottles just laying around the house. These are very treatable conditions. And sometimes it's not, it's a journey. Sometimes we do have to try many different strategies to get people feeling better. But we're on this journey together. So, we have to kind of work through it. I think it's a really important thing for us to discuss as a society and lower the stigma associated with getting treatment for mental health problems.
Thank you to everyone for joining us at home. And for more health tips during the COVID-19 pandemic, please visit the Lehigh Valley Health Network news blog at news.lvhn.org.